This presentation covers the basic physics and instrumentation of ultrasound. The objectives of this presentation are to define ultrasound and its parameters, to discuss the relationship between frequency and wavelength, to describe ultrasound image generation and display, to describe the effect of tissue density on sound travel, and to discuss the different types of ultrasound image resolution and what parameters affect image quality. Sound is a form of mechanical energy and involves the physical movement of particles within a medium. Sound waves can only exist in a medium that contains molecules such as water, air, or soft tissues. Sound waves above 20,000 Hz are above the range of human hearing and are called ultrasound. Medical diagnostic ultrasound uses a frequency range between 1 and 18 MHz. The ultrasound machine consists of a computer, a video display, and transducers. Crystals lie side by side and are made of lead zircon titanate. Most portable systems would have at least 64 crystals. They are brittle and fragile. If you drop the transducer, you will get crystal dropout. Generally, you lose a bank of crystals, not just one, so you won't get a full image, potentially missing pathology. In between the two green arrows is an area of crystal dropout. Underneath that area is a great big thrombus sitting in the internal jugular vein, and the yellow arrow is pointing only to a very minimal component of that thrombus. Crystals cannot be replaced or rebirthed. The transducer needs replacing. This costs about $10,000 to $14,000. Transducers come in all shapes and sizes and are used for different organs and for different reasons. Linear transducers place the crystals side by side in a straight line. They give a rectangular field of view and are used for muscles, tendons, nerves, vessels, foreign bodies, or anything close to the skin's surface. This example shows the anterior hip joint. You can see the acetabulum here, the head of the femur here, and the iliopsoas tendon across the surface of the joint. Curved arrays, or the curvilinear probe, have crystals that are shaped in a convex arc. The ultrasound beam diverges, so the image appears trapezoid-like. This probe is used for abdominal and pelvic organs, for obstetrics, and for structures that are deep within the patient. The image to the right shows a liver and also the upper pole of the right kidney. The sector or vector phased array is similar with less crystals and a smaller footprint. This transducer is designed to fit in tight spaces, such as in between ribs, scanning the heart, lungs, abdomen, and even some obstetric and gynecological applications. This image to the right is a parasternal short axis view of the heart, showing the aortic root in the middle of the image. Tightly curved arrays are very similar to the curvilinear probe, except that the curve is much tighter, as seen in this schematic. The frequency range of these probes is at a mid-level, so they scan between 9 and 5 MHz or between 8 and 4 MHz and are used for intracavity scans such as transvaginal scanning for gynecological purposes or for the assessment of first trimester pregnancies. This image on the right shows a tightly curved image in the near field which widens out considerably, and we can see a transverse view of a fundus of the uterus with an intrauterine gestational sac. To generate an image, crystals undergo the piezoelectric effect. Crystals convert electrical energy that comes through mains electricity into mechanical energy, which is a sound wave. The sound then interacts with the patient's tissues and returns back to the crystals with a different energy level. The sound wave then hits the crystal and is converted back to an electrical signal. This signal is displayed as a shade of grey on the monitor. To generate an image, the crystal sends out a pulse, then switches from transmission to reception to wait for the returning echo. If it doesn't take a long time for the sound to go in and come back, then the target must actually be close to the surface, and the returning echo image is displayed in the top half of the screen or the near field. If the target is deeper in the patient, the sound takes longer to return back to the transducer, and the echo is placed in the far field or in the bottom half of the monitor. How does ultrasound travel? If one molecule in tissue is set in vibration, then it will cause its immediate neighbours to vibrate, and in turn their neighbours, until the vibration has passed through the entire tissue. This is called a sound wave. A sound wave needs a medium for transmission, either solid, liquid or gas. Transmission is poor in gases as the molecules are too widely spaced to allow the vibration to be passed on easily. This explains why lungs have limited imaging. As an ultrasound wave travels through tissue, it alternates between compression, or a crest, and rarefaction, or trough. A cycle is one crest and one trough. The number of cycles per second that occur is known as the frequency of that ultrasound wave. The unit of frequency is hertz. Wavelength is the length of the wave. Its symbol is lambda, and the unit of wavelength is millimeters. Wavelength is the distance from one point in one wave and the same point in the next wave, and it's linked to image resolution. Frequency is inversely proportional to wavelength. As this video plays, you can see as the wavelength gets shorter, characterised by the red line, the frequency increases. When we talk about resolution soon, you will see that higher frequencies provide better spatial resolution, but the trade-off is that the depths that you can penetrate are less. Velocity depends on the closeness of the molecules to one another, known as the density of the medium. The closer the molecules, the faster the vibration is passed on and the faster the velocity. You can see from this schematic that because air molecules are further apart, the speed of sound in air is much slower than in tissue. Velocity or speed of sound is a unique value for each organ in the human body, and its symbol is C. The average speed of sound in human tissues is 1540 metres per second, and this is the value that the ultrasound machine measurement algorithms use to calculate the position of an echo on the image display. Acoustic impedance is a measure of the tissue's resistance to the transmission of sound waves. It is determined by multiplying the tissue density by the speed of sound in that particular tissue. The higher the tissue density, the higher the impedance. The higher the speed of sound, the higher the impedance. Higher impedance means there is higher resistance in that tissue to the sound waves. From the table, it can be seen that bone is very resistant to sound waves, but urine in the bladder, which is similar to water, is not. Now we know what the parameters of ultrasound are, we will determine how they affect our image resolution. Image resolution is how well your system can define different anatomical structures, differentiate between tissue types, and to display dynamic structures over time. There are 4 types of image resolution: spatial, contrast, temporal, and colour. We will cover spatial resolution in this presentation only. We'll begin with spatial resolution. This is your system's ability to detect and display structures that are anatomically separate. There are 2 types: axial resolution, which is along the path of the beam or down the screen, and lateral resolution, which is across the path of the beam or across the screen. Good axial resolution requires echoes returning from different structures along the beam path be displayed separately. Resolution along the beam path or down the screen depends on the spatial pulse length, and this is determined by the beam's wavelength. When the crystals send out a pulse during transmission, the crystal must switch from transmission to reception to wait for the incoming echo information. If the pulse length is too long, the crystal will switch back to transmission and send in the next pulse before the echo information is received. If this occurs, that echo information remains unresolved. Therefore, the shorter the wavelength, the better the axial resolution. We have already seen earlier in this presentation that wavelength and frequency are inversely proportional. Therefore, to ensure that we have a short wavelength, we must always select the highest possible frequency for our task. This is an operator-dependent function. In the top ultrasound image, the smaller hypoechoic areas, which are the medullary pyramids seen with this white arrow, are well visualized, whereas in the bottom ultrasound image, the corresponding area is not so well defined. Because axial resolution is dependent upon the wavelength and therefore the frequency, it is very important to understand the practical application of selecting the correct frequency for the type of scan you wish to undertake. This table gives you a quick guide to which transducer is used for a particular task. Good lateral resolution requires echoes returning from different structures across the beam path be displayed separately. Resolution across the beam path or across the screen depends on the beam width and is best at the focal zone. The operator sets the focal zone on the image by adjusting the focus button on the ultrasound machine. The focus should be placed at the back of the object of interest. This parasternal short axis view on the left here shows how poorly defined the papillary muscles are, seen by the green arrow, and this is in comparison to the image on the right, where the green arrow clearly shows these papillary muscles to be well defined. This is a video clip that displays how the focus optimizes the fluid in this lung. This is an image of the left upper quadrant, and what we can see here is the spleen, the upper pole of the left kidney. The shiny white area here is aerated lung, and also this smaller black area seen at the deepest portion of our image is actually a very small pleural effusion. Now, as we watch this clip replay a few times, we can see that along the depth indicator here is two small little arrows that move up and down the image. When those little arrows are level with the back of the image or at the position of the pleural fluid definition is much better than when those two little arrows are placed right at the top of the image. Then the pleural fluid actually looks more blurry. So by moving our focal zone to our object of interest, we are defining the pleural fluid much more clearly. The operator controls for best spatial resolution are: select the correct transducer for your task, select the correct frequency for the depth required, and position the focus at the back of the object of interest. In conclusion, we have discussed ultrasound parameters such as frequency, wavelength, and cycle. We have discussed image generation and display. We have looked at the relationship between frequency and wavelength, the tissue density and how sound travels through tissue, and we've also discussed the parameters of spatial resolution. Our next topic will be how sound interacts with tissue. Thank you.